I'm Mrs. Princey, Associate Professor in Mental Health Nursing. You've already learned about the condition schizophrenia, right? Very important psychiatric condition, which is very common, and also what are the various types of schizophrenia we have, and what is the treatment modalities. Mainly the use of the antipsychotic medications. We've got a lot of side effects, how to manage those, everything that you have learned. Now, coming to the role of the nurse, very, very important when you are going to give a care for a schizophrenic patient. What is the nurse's response? So the topic for today is the nursing management of client with schizophrenia. So when it comes to the nursing management, you've got the nursing process, which includes the assessment, nursing diagnosis, planning the interventions, and doing the evaluation. Number one is the nursing assessment. So here you've got the subjective assessment and the objective assessment. When it goes for a subjective assessment, you're going to collect the information, the history collection that you can do from the patient as well as the relatives of the patient. You're going to find out the history of the client. What is the pre-morbid personality? How is his, areas of functioning in terms of occupation, social relationship, in terms of personal relationship? How is he maintaining the family, or how is he, doing the self-care? Or what are the symptoms that they can observe? So all those things that you're going to collect in the history. When it comes to the objective information, you're going to observe the client, you're going to look in for the signs and symptoms of schizophrenia. It can be the major symptoms of psychosis like hallucinations, delusions, the types of hallucination or delusions. When you even talk to the patient, you can understand whether he is having the symptoms of echolalia or echopraxia, circumstantiality, tangentiality, flight of ideas, all these symptoms that you can note when you even talk and observe the client's behavior, right? Now, based on the symptoms, what the client is exhibiting, you can plan the nursing diagnosis and do the intervention. So, here I'm going to talk about few nursing diagnoses and the interventions. Number one is disturbed sensory perception, that is because of the auditory or visual hallucination which the patient is having, related to the panic anxiety, extreme loneliness, and withdrawal to self, as evidenced by inappropriate responses, distorted thought sequencing, rapid mood swings, poor concentration, and disorientation. Right, this is the first nursing diagnosis that you can state, which is the disturbed thought process. What are the nursing interventions for this? The first thing is you have to convey to the client the acceptance of the client's need for the false belief. Yes, the client is saying that he is the god or a goddess. You know that it is delusion of grandiosity, but also you should be able to, convey that he is accepted as is. The second thing is you're going to observe the client for the hallucination. You do not know the most common type of hallucination is the auditory type of the hallucination. You're going to find out whether it's a first person auditory hallucination, second person, third person auditory hallucination, whether he is having, apart from the visual hallucination or olfactory, gustatory, tactile, what is the type of the hallucination the client is having. Avoid touching the person or the client without warning him or her. So, since the client is into the world of fantasy or hallucination, you do not know when he will strike you. So, always try to avoid touching the client. Next thing is not to reinforce hallucination. Yes, you know the patient is undergoing or is into the world of hallucination, doesn't mean that you go and try to involve the client more in the hallucination, right? But rather than that, you can distract the client from the hallucination, divert the client's mind, which is really going to help the client. Help the patient understand about the connection between the increased anxiety as well as presence of the hallucination. So see to it that whenever the clients get very much anxious or very much stressed out, they may end up with a hallucination. See to it that always a client is diverted, is involving in some kind of a constructive activity or the task, so that he doesn't get the hallucination. And also don't give the activities which are, so that is the first diagnosis, which is disturbed sensory perception. The second nursing diagnosis that you can state is a disturbed thought process related to panic anxiety, possible hereditary or biochemical changes or the factors as evidenced by delusional thinking, extreme suspiciousness of others. Now, what is the nursing interventions that you can plan? First is you're going to assess the content of delusion. So you're going to find out what type of the delusion the person is having, whether it is delusion of grandiosity, delusion of persecution, right? Delusion of infidelity. What type of the delusion the client is having, you're going to find that out. You're going to assess the intensity, duration, and the frequency of the delusion, which is very, very important to plan the treatment. Try to reinforce the client and to focus on the reality. Don't give him time to just sit alone and be in the world of fantasy. Okay, always involve the client and make the client lively to be in the world of reality. Again, avoid the physical touch or the contact with the patient because you do not know what type of a delusion that he is undergoing, which will make the client to strike you again. As a nurse, you have to avoid laughing, whispering, or talking quietly to another health professional or to any other people because the client will always have these delusions which is going to think as a persecution. So do not laugh or do not whisper or talk slowly to any people around client, wherein again the client will have the delusion. Encourage the client to express his feelings or ideas. Educate the patient as well as the family that yes, this is what the client is undergoing, that even at home that they have to see to it that they don't make the patient to be isolated or sit in separate room and talk to the other family members, whispering, laughing. All this is going to worsen the condition of delusion in the client, and not do that by the family members. The next nursing diagnosis is the risk for violence related to the command hallucination. What are the nursing interventions for this? Always maintain the environment of the client. See to it there is a low level of environmental stimuli. Observe the client's behavior frequently. Remove all the dangerous objects from the client's environment. So it should be out of reach. It can be the sharp equipments or the glasses or any kind of items, ropes or furnitures which is going to help him during the time of the violence to quickly take that and harm someone else or harm himself. Provide a structured environment to the client with limited furnitures and equipments wherein he may misuse it during the violence period. Do not use any kind of physical restraints or techniques when the client becomes very much violent. Rather than using those techniques, you can talk with the patient in a low voice, which is going to reassure the client, and also try to divert or distract the client during the time of the violence. That is about the risk for violence. The next nursing diagnosis we have is the impaired verbal communication related to panic anxiety, unrealistic thinking, as evidenced by loosening of association, echolalia, verbalization that reflect concrete thinking, poor eye contact. What are the nursing interventions for this? Do an attempt to decode the incomprehensible communication pattern. So, yes, it can be use of clang association or the neologism, verbigeration, perseveration, all these circumstantiality and tangentiality he will have right when he communicates. So try to decode the information even though it is not comprehensive. Anticipate and fulfill the client's need. Always, as a nurse, you should be ready to meet the needs of the client. Facilitate the trust and understanding. You're going to accept the client exactly as he is. Talk to the client, build that rapport and trust so that he will be able to ventilate his feelings. And as a nurse, you will be really there for the client to help him out at difficult times, right? So these are some of the nursing interventions that you can plan for the impaired verbal communication. medication. So very important as a nurse when you're caring for a client with schizophrenia, that you have to have a vigilant sensory system, that you have to monitor the client, you have to be with the client, assist him, involve him in various activities, educate him, motivate him. Even the family has to be motivated so that they also can support the client. Hope you all have understood the topic.